Hi everyone! Have you been postponing taking your child for a routine dental visit because you're worried about COVID? I think we can all agree that this coronavirus craziness has caused lots of fear and anxiety and presented all kinds of unexpected challenges. And as we're all adapting to this new reality, I thought it might be helpful to do a video on children's dental emergencies so that you can feel better prepared to know how to handle those and if and when to seek care for your child, and to also reassure you that you can do so very safely. So my goal for today's Tooth Talk Thursday then is to just shed some light on common children's dental issues and how to address them, and also to hopefully provide some reassurance for certain things that may seem like emergencies, but that once you know what's actually going on, you can have some peace of mind. So we'll break today's video down into 4 topics. The first will be pain, and so reviewing some common sources of pain. Number 2 will be infection. Number 3 will be trauma. I actually did a separate video on toddler tooth trauma, so there will actually be just one big topic in trauma that is essentially the only truly time-sensitive emergency in the dental world. So that's an important one. If there's going to be one take-home message, it'll be that when we get to it. And then the 4th and final thing will be something that we'll just call, is that normal? So I know everyone's very busy. We will cut straight to the chase and start with pain. So when it comes to pain, pain can be caused by lots of things, of course, but let's start with a couple of things that every single child will experience no matter what. The first being, teething or tooth eruption. Some kids are more bothered by this than others, right? So, and also I should say, so teething gets the blame a lot of times for children's, crankiness or them not acting right or feeling well, and it's the only thing we can see that's changing about them. But there are so many other things that can contribute sometimes when they seem a little bit under the weather. They should certainly not have a high fever from teething. If that's the case, just know that you cannot blame teething for that. It's something else going on. But in general, if they seem a little fussy and you notice that new teeth seem to be emerging through the gum tissue, just giving them some cold things to kind of suck on, like even a cold wet washcloth, gnawing on appropriate toys that are intended for this. The one thing you want to avoid is actually 2 things. One is those topical anesthetic gels like Oragel. Stay away from that. The pain relief is very transient and really not appropriate because they're going to be swallowing all that, and that can actually be dangerous. So avoid that. The other thing, safety-wise, teething necklaces, too many risks in terms of strangulation, or if they break apart and they accidentally swallow or, God forbid, aspirate on like a bead or something like that. So also those are not really safety sanctioned, so I would avoid those. But when it comes to evening time, if you think like it might be a rough night, whether it's teething or teething plus God knows what else, the miracle drug that we always use is just plain old children's Motrin. It seems to really do the trick between having a restful night or one that's full of irritable wakings and just lots of fussiness. So make sure you always have children's Motrin on hand. It helps with so many things. And then also kind of along a similar theme of growth and development and all the natural changes is, if you have a child that's between 5 or 7 and they're going through their first episode of losing baby teeth, that can sometimes be uncomfortable, as they become loose and wiggly and mobile. Again, some kids are more bothered than others. Some kids love it when they have loose teeth and they cannot wait to yank those puppies out of there. Other kids are very guarded. They do a lot of avoiding. They don't want anything or anyone to touch those. But if your kid's okay and you're a somewhat adventurous parent and you don't mind getting in there, helping them get control of the situation, help them by both wiggling but also really twisting the tooth, especially if it's going to be a front tooth. The first few are going to be the front teeth, of course, and so the twisting is a really good mechanism to remove a loose tooth. And then once it's gone, there may be a little bit of bleeding, but overall that will address the pain. Another common thing that a child may complain that they have a toothache, but it could be that there's some food stuck in between their teeth, and that would typically be in the back, so between, a pair of baby molars. So try to take a flashlight or your phone light and just get a good look, get some floss in there. Chances are you might be able to remove something that's trapped, and that should provide, more or less instant pain relief. And don't be alarmed if there's a little bit of bleeding from the gums, because if there has been something wedged in there, the gums will be inflamed and they will bleed pretty easily. So just, that'll be okay too. And if it seems super inflamed and it's still tender even after you've removed whatever the irritant was, again, Motrin's your friend in a case like that. It should be very short-lived. Another thing that can cause pain, and again, a child may not be able to identify exactly what it's saying. They might say, my tooth hurts, but make sure that you're not just looking at the teeth, but that you also take a look at, what we would call the soft tissues. So, hold the lip out of the way, look on the inside of the cheek. They might have some kind of ulcer, either from something traumatic that happened. Maybe they bit their cheek, or sometimes it could even be food, like maybe the sharp edge of a tortilla chip or something like that. So they might have a little ulcer, and that really just needs to heal, right? So in the meantime, just avoiding irritating that injury more by avoiding spicy or acidic foods and drinks, and then just knowing it'll take a few days before everything is healed back up. And just be extra gentle when you're brushing there, because those things can get exquisitely painful. There's one type of ulcer in particular, and it's not necessarily linked to trauma. Some people just tend to be somewhat more prone to this, and there can be underlying causes, but I don't want to get overly technical on that, but it's called an aphthous ulcer, and that typically looks like a white circle, like a circular patch with a red ring or a halo around it. And those can be very, very painful. And if your child gets them frequently, it's worth investigating if there's an underlying cause, because there probably is. If it's just like a once every blue moon thing, probably not, you don't have to worry too much, but just knowing how to handle that. And typically you wouldn't need to, bring them in for a visit, because there isn't going to be a whole lot that we can do either. Sometimes, if it's really large and really painful, we could prescribe a medication, but for the most part, they're self-limiting and will go away, but it can take up to a week. Obviously, pain can be caused by cavities, which would be if it's a large enough cavity that there's an actual hole and you have food impaction, then you're kind of back to that problem, in addition to the fact that the tooth itself might be sensitive or painful to hot or cold or sweet. If there's a cavity, that's not a do it yourself at home. So you would definitely want to bring them in kind of sooner than later. It's not so urgent that it has to be same day, but just make sure that you don't delay the care too much, because especially in baby teeth, cavities tend to progress pretty rapidly if nothing is done. And so you may be looking at a tooth that could have been salvageable, but if you wait another week or two, suddenly we're at the point of no return, and it may have to be removed prematurely, and that's never fun. And then along the same line, you also can have pain from infection. An infection in the mouth can be caused when a cavity gets so large and deep, when the bacteria kind of burrow their way into the core of the tooth and cause irreversible damage to the vital nerve tissues inside. And those then, as those are beginning to die, that's painful. Or if the tooth has actually, all that vital tissue has died and has become necrotic, then it's only a matter of time before you would see what we call an abscess, which is a localized infection. And typically the way that looks in the mouth is like a bubble or a pimple. And you would see it on the gum tissue next to, the tooth in question. So also be on the lookout for that. Now, one other scenario where you can see an abscess even in the absence of any kind of cavity or tooth decay is if there's a history of trauma. If there's a history of trauma on the tooth, then you can also get this nerve tissue death. And so if you see anything suspicious along the lines of a bubble or a pimple, also want to go ahead and call and make an appointment. So in some cases, when there's an infection, depending on what it is, especially if it's not localized, if it's actually spread and now you have facial swelling, then a course of antibiotics would be appropriate first. In severe cases, the antibiotic may have to be given IV, which would be obviously not done in a dental office. That would be emergency room or maybe urgent care. But in most cases, oral antibiotics potentially first, and then controlling the source, meaning getting that sick tooth out of there if it's a baby tooth. If it's a permanent tooth, then there are other methods to deal with that, to try to save the tooth but still clear the infection with root canal therapy. So on the topic of trauma, which is number 2, the one big thing that I want to mention is, what would you do in that very scary situation of having a permanent front tooth knocked out from some kind of severe blow? So first thing is, don't panic, but find the tooth, because you want to try to put it back in ASAP, and also call your dental office ASAP to get them ready to know, hey, I'm coming, there's a loose tooth. Either you're able to reinsert it yourself, which would be ideal, and then have your child bite on a washcloth to stabilize and keep the tooth in place until it can be splinted in the dental office. If you can, or you just don't want to, you want to store it. You don't want to have it be dry. You want to store it in either milk, if you have access to milk, put it in that. If you don't have access to milk, then saliva will do. Just do not store it in water. Water can be harmful because it will kill the cells that are on the root of the tooth. And by the way, when you, I'm going to just do a quick little, this is actually a baby tooth model, but so imagine you find the tooth. So you want to, right now I'm holding it from the root, but you don't want to hold it at the root. So the root being the ice cream cone looking part. Hold the tooth by the actual white part, so the part that you would normally see. Hold it there. If it landed in some kind of dirty environment and you can visibly see, dirt, you can give it a quick rinse. Go ahead and cleanse it briefly. Stick it back in a way that makes it match its partner tooth, right? And then have your child come in like that, ideally. And then storing it in saliva, even if you have to basically spit into a baggie or a cup and then put the tooth in there, better than complete dryness. But do not put it in water. I would just want to reemphasize that. And the prognosis for a tooth like that that's been knocked out is way, way, way better if it's reinserted and dealt with under an hour from the time of the accident. If it's been over an hour, the long-term prognosis is really, really bad. So that's why I was saying it's the one truly time-sensitive emergency that requires immediate attention. And then that brings us to the final thing, which is that normal? And this is kind of like a cute, fun one, but over the years of pediatric dentistry, we've gotten so many calls about a parent being concerned with, my child is growing a second row of teeth, or new teeth are growing in, the baby teeth are still there, like what should I do? And while that can be alarming for a parent who's never seen that or experienced that, it's very typical for those lower 2 front teeth to begin to erupt even before the baby ones or the primary ones have fallen out or exfoliated. So let that just be your sort of your warning sign that, hey, it's time for these baby teeth to come out. So get into the habit of helping your child, like try to loosen them more and wiggle them out. And if you can't, do set up an appointment for us to help you with that, because as those new teeth grow in and sort of become taller, there comes a point at which it's a little bit more challenging to actually grab and remove the baby tooth. So you don't want to wait too long. We're talking about you have at least a few weeks or maybe even a month or more. But yeah, so, and then once that little, baby tooth or baby teeth that have overstayed their welcome are out of the way, the permanent ones can typically move forward on their own. And I just realized that I don't think I actually introduced myself in this video. So after all this, who am I and why am I talking about this? My name is Dr. Bana Ball. I am a pediatric dentist and the founder of Shady Pediatric Dentistry in Rockville. Our office opened in it was completed in May of 2020. In the early days of the pandemic, because it seems like this pandemic is not done with us anytime soon. And We have a wonderful space here that we designed with the comfort of children and parents in mind, and we are happy to help you in any way that we can. If you want to establish a dental home for your child, we would love to be that place for you. If you have an emergency, since we are a pretty new office, we have a lot of flexibility in our schedule. We'll be able to see you probably the same day, or at the very least the next day. So there's going to be more information in the text. And I'm happy to answer any kind of follow-up questions if you have any, or take any requests for other topics or questions you may have. And I thank you so much for watching. Hopefully this was helpful. Let me know if you have any questions, and I will hopefully meet you one day. Take care. Bye.